Hi, it's Kristan with Women's Care Center. Welcome to the second video in our pregnancy series. Prenatal care is important from the moment you get that positive test until the day that you deliver. Regular prenatal care can lead to healthier pregnancies, which then leads to full-term babies. A full-term baby is a baby who has been given the amount of time that she needs to develop in utero. Today, let's talk about what to expect during the next 9 months at our prenatal checkups. But before we do that, let's do our breathing exercise. With your eyes closed, take a deep breath. As you exhale, imagine any stress or anxiety that you may be feeling today begin to leave your mind. For the next few moments, focus on your breathing. A deep breath in and a slow breath out. Anytime during the day that you feel that anxiety begin to creep back in, take a moment and practice your breathing. It won't take very long before you'll soon feel more relaxed and calm and ready to face what's next. Prenatal care includes things like nutritional advice to ensure proper weight gain, monitoring baby's growth and development, and exams and tests to detect any potential complications. It's also a time for you to discuss any discomfort that you may feel and ask questions regarding pregnancy and delivery. Different providers can give prenatal care. OBGYN, family practice, maternal fetal medicine, a certified midwife, or a family nurse practitioner can all take care of you and baby during pregnancy. Some pregnant women are referred to a doctor who has experience in high-risk pregnancies if she has any chronic health condition. She also may be referred if there is any increased risk of preterm labor, if she's over the age of 35, or if mom is expecting more than one baby. Some things to consider when choosing your prenatal care provider include, is this provider covered by your insurance? Would you be more comfortable with a male or a female provider? Where is the office located, and do office hours fit your schedule? Who handles emergency phone calls after hours? Is the provider part of a group practice? Who in the group practice will deliver your baby? What hospital or birthing center does this provider use? And who do your family and friends recommend? During the first few months of pregnancy, you will see your provider once a month. Starting around the 28th week, you'll begin to see her twice a month. And during the last few weeks, you will go in for a prenatal checkup once a week until baby's born. If you're experiencing any complications, your provider may want to see you more often. Your partner, a family member, or a friend are welcome to attend your prenatal checkups with you. Sometimes it's helpful to have another set of ears to listen and perhaps even take notes. It can be easy to miss information or instructions, and a support person can help you remember after you leave the office. Your first prenatal appointment will likely take the longest because your provider will want to get your health history. The first appointment should be made the first 6 to 8 weeks of pregnancy. Each visit includes checking your weight and your blood pressure. A pregnant mom who begins pregnancy at a normal weight should gain between 25 and 35 pounds. Starting around weeks 10 to 12, your provider will begin to listen to baby's heartbeat. Once you hit the 20-week mark, your belly will be measured to keep track of baby's growth. Later on, providers often will also feel your belly to check baby's position inside. Between the weeks of 18 and 20, most women get an ultrasound. If you want to know baby's gender, now is the time to find out. Sometimes providers will do another ultrasound later on in pregnancy to check on the amniotic fluid. Once you begin to feel baby kicking, providers will ask you to be aware of how often you feel movements. Keep track of how long it takes to feel baby move 10 times. Remember, sometimes it's easier to feel baby move when you're lying down. A glucose screening is done between the weeks of 24 and 28 to check if you have gestational diabetes. You will be given a thick, sugary drink, and then an hour later, your blood sugar level will be tested. If the reading is high, another glucose test will usually be administered. If you are diagnosed, your provider will have specific instructions about your diet and any medications that you may need. Towards the end of your pregnancy, your provider may also suggest getting a Tdap vaccine to protect you and your baby against whooping cough. Screening tests or diagnostic tests may be suggested by your provider to detect risks or signs of possible health problems for you and your baby. Depending on your age and other risk factors, some people have a higher risk for birth defects than others. Be sure to ask questions. Understand the reason, the test, and the meaning of results before any screen or test is administered. Discussing these details can help you and your provider decide what is necessary. It's important for you to feel comfortable with your provider and the level of care you're receiving. This is a new experience. It isn't always easy to ask questions, but it's extremely important that you do so. Whether you're struggling with constipation or hemorrhoids, just remember there isn't a question that you could ask that your provider probably hasn't heard before. These 9 months are full of excitement and anticipation, but it's also a time to have your questions answered and any fears relieved. Prenatal care can have a significant impact on you and your baby's health and wellness. Taking care of baby starts with that positive pregnancy test. Thanks so much for joining me. I'll see you next time. Bye-bye.